Hello, 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 everyone. This is Dr. Mary Payton with All About STEM Radio. As you know, I come to you every Monday from 6, not from 6, I come to you every Monday from 7 to 8 p.m. on Fishbone Radio Network from Globe Life Park, Arlington, although I am still on the big island of Hawaii. And, that will be at least till the end of the year. And I'm still loving it here, although I don't get out to see some of the things that I want to, but that's okay. Before we get started, I still want to give shouts out to all of my teachers and STEM workers and essential workers that are out there, and all of my STEM and STEAM organizations that are hosting free and low-cost things for our families to do. And mentioning that, we have, or there is, not a we, I'm not part of it, although I support this organization so much, the second annual STEM Success Summit is coming up. It's on November 19th and 20th, and they'll be on the first week of November to come in and talk about it. I went to it last year. It was all online. It was wonderful. If you are a STEM or a STEAM person, an engineer, someone in medicine and math, science, any of those fields are interested in it, this would be a great opportunity for you to take a look at that. And if you want to know more about registration, it is on the All About STEM Radio Show Facebook page. And also, I got to tell y'all what I did this weekend. I went to the Hilo Coffee Mill up in Mountain View here on the Big Island because I had to go get me some lava brittle, which is like the best thing in the world. And if you ever make it to Hilo and want a great cup of coffee, please, please, please try the Hilo Coffee House up in Mountain View. And finally, don't forget, Taylor STEM Adventures Hawaii and Taylor STEM Adventures Texas are still on sale. They have just received the award of a good read from Reading with Your Kids. I am so excited about that. Now, without any further ado, I want to introduce, if we're Facebook Live, I don't know if we are, y'all see this young man on the screen. If not, I have a young man on the screen that is, I have to laugh because when I first met him, I said, oh, he's a doctor. And that was one of the things that his wife always laughs about. But his name is Dr. Fernando Najar. He is a OB, not OBGYN, but a doctor of osteopathic medicine, OD. D-O-D. He'll explain it to you. And he is awesome. And I mean, he looks like he's like 19, but he's a little bit older than that. But he's an awesome young man. Dr. Najar, would you tell our guest, would you say hi to our guest and tell them a little bit about yourself?
Hello, everyone. My name is Fernando Najar, like Dr. Payton said. I am over 19 years old. I'll leave it that way. I am originally from El Paso, Texas, and Juarez area in Mexico. That's kind of where I was born, grew up, was raised there. I ended up doing undergrad at Baylor University, and then I went into medical school at the UNT Health Science Center in Fort Worth, the Texas College of Osteopathic Medicine. Did that for 4 years, and then went up to do residency at the University of Texas in Houston for pediatrics, general pediatrics. Completed that. I'm a board certified pediatrician, and then now I'm currently at the Baylor Scott and White hospital system in Temple, Texas, doing a neonatology fellowship.
Wow. First, I got to ask you, Temple, Texas. El Paso is nice and big.
Yeah.
DFW is nice and big.
Yep.
Houston is nice and big.
Yep.
How is it being in Temple, Texas? I've been to Temple a lot of times.
Uh-huh.
So how is Temple?
Honestly, for me, it's a little more challenging because like you said, I'm used to the big town, right? Like, I'm used to the driving. I'm used to the just anything you want kind of thing. You can have it at any point of the day. So that's made a little more adjustments, a little quieter, no traffic for sure. It's really nice to pretty much get through the entire town without knowing that you won't have any traffic, maybe in 15, 20 minutes. But I would say that it's been a little bit of an adjustment, going to a smaller town. But it's something that I've never experienced, and I always use them as learning opportunities to grow and see what there's always something to learn.
Yeah, it is. And knowing you, knowing your wife, y'all are like very flexible with everything, and enjoyed looking and doing new things. And I know you're on vacation now, so I'm glad that you came on to the show.
Yes.
Now, let's talk about your making the decision to go into medicine.
Yes.
What was that journey?
It was. I think it's been a roller coaster. It definitely has been very exciting, but it's also been very difficult at times. What actually got me inspired into medicine I started very young, as one of those little kids who was like, I want to be a doctor. Like since I was like 4 or 5, my parents were like, yeah, sure, you can be a doctor. But what really inspired me was actually I had an asthma attack when I was about 5. Couldn't breathe, and my pediatrician, my parents took me to a pediatrician at 2 a.m. He had like 24-hour service at the time. Mm-hmm. Took me there, got a breathing treatment, got better, like pretty much left the clinic from there running, jumpy without any problems. My parents were freaking out, and I was like, yeah, like I can breathe again. But that kind of got me inspired into, it's like, hey, you know what? I think I like this. I want to be able to do that to somebody else. I want to be able to help like that. And that's kind of more where the seed kind of started into like, hey, I want to be a doctor. And then my parents have always been very, they've always, been behind me. They always have always been there for me. Try to open as many doors as they could. And so throughout, I was actually living in Mexico at the time, with bilingual school. My parents always wanted to be bilingual, English and Spanish. And then, throughout all of my school years, the seed for medicine, the seed for wanting to be in the medical field was always there. So in high school, I actually applied to a health magnet school back in El Paso. And so it's called Silva Health Magnet High School in El Paso, Texas. And essentially it's a school that accepts people kids from all over the city, pretty much who are interested in the healthcare field. They don't necessarily have to be doctors or want to be doctors, but anybody in the healthcare field. And they actually you start taking health classes your freshman year, and you learn terminology, physiology, a little bit of anatomy. And then once you become a junior, they kind of split the paths, and there's a nursing program that you can do where you kind of are part of the college program, a concurrent real nursing program in high school, or you can just do rotations where they'll rotate you through a dental practice, physical therapist, occupational therapist, medicine. And I knew I wanted to be a doctor, so I went through the nursing route. I actually went through nursing school because I wanted to see if the hospital was right for me. Like, do I like the hospital? You always say you want to be a doctor, but until you really see sick patients, sick persons, sick people in general, is kind of what really opens your eyes, whether that's something that you really want to do or not. And it did. And so from there, it just kind of catapulted to going to Baylor because I had heard the pre-med program was really good. I studied chemistry at Baylor. I have a BS in chemistry and a minor in biology, along with a pre-med. And then from there, went through the usual pre-med route towards medical school.
Yeah. Now, okay, after you left Baylor, how did you select going to UNT? Because I'm a UNT fan because our family used the UNT medical system and have been for almost 30 years now. Because one of your professors, Dr. Schran,
yes,
is our family doctor and has been since he was a resident.
And long ago, you and I remember talking about him specifically, and he's a good doc. So the part of the medical school acceptance process, at least in Texas, and it kind of varies a little bit in the nation. There's a application process that kind of is universal for all the Texas schools. You can apply there, and then you get to decide and choose what med schools you want to apply. You can apply to all the medical schools in Texas, and so I did. And after you apply, you have to do your primary application process, and then you sometimes have to go to secondary applications, meaning like they ask you to write an essay, they ask you to write different things or different requirements that they ask, and then from there they review your application, and then they call you for an interview. You usually go and visit the medical school, they give you a tour, and you interview with different doctors there. And then after that, you just kind of waiting game, and you just wait to hear back and see which schools call you back, if any. And then at that point, if more than one calls back, then you get the freedom to choose where you want to go, or which one you would like to go more, based on location, based on the program, based on the, whatever it is that you learned from the interview. And that's how most of I would suspect most of the medical students do it. Nationwide, there's a different application process. Also, I can't remember what the name of it is, but you also kind of fill that out, and then that gets sent to all the medical schools, or whichever medical school you want, and they come back to you and be like, hey, this is our secondary, like more specific to that specific school. And then you still have to, fill those out before they consider application, and then also have to go and interview there. And the same process works. And that's kind of how it ended up. And so I ended up getting accepted at UNT. So that's kind of how I ended up in Fort Worth.
Mm. And I know I've visited UNT a few times and took a few tours through there when I was working at Wesleyan. And you not only have a pre-med school, they also have a pharmacy school. Do they? There also.
Yeah. So the UNT campus is in Denton, and then the UNT Health Science Center is in Fort Worth. And the Health Science campus has the medical school, has a pharmacy school, has a physical therapy school, has a master's and a PhD school, like a graduate school, and PAs, physician assistant school as well. So it's a whole gamut, if you will, of the health sciences that they actually have there.
I didn't know about the last three things. I knew about the pharmacy and the medical school because I've dealt with students out of both of those programs. Ladies and gentlemen, if you are just joining us, this is Dr. Mary Payton with All About STEM Radio. I am talking to a wonderful doctor, Dr. Najar. He is currently at Baylor Scott White in Temple, Texas, which is a wonderful little town. Although it's a little town, I've been there quite a few times. And he's telling us about his journey into becoming a doctor, pediatrician. And so I'm so excited about this conversation. Now, Fernando, I want you to clear something up for me. Mm-hmm. What is the difference between a residency and a fellowship?
Okay. Yes. So the residency is primarily residency is kind of the requirement that, or how medical students choose their specialty, essentially. So if you want to go to pediatrics, you go to the pediatric residency, or if you're going to go to family medicine, you go through the residency part. Internal medicine, general surgery, orthopedic surgery, things of that nature. The fellowship aspect of it is more of a subspecialty within that subject, meaning if you want to become a pediatric cardiologist, right? Oh. You do your residency first in pediatrics, and then your subspecialty would be in pediatric cardiology. That would be the fellowship, which would be extra training. Or if you wanted to go, even the adult side, if you wanted to go to see a cardiologist, those cardiologists usually go through the internal medicine residency, and then they specialize within that, or subspecialize into the cardiology or into nephrology, right, or pulmonology, or critical care, whichever route it goes. So fellowships are primarily a subset or a more subspecialized area of that field that you chose. And so in my case, I did pediatrics as my residency, general pediatrics. And then right now I'm in fellowship for neonatology, or the Nicu, which is a subset of pediatrics. Like people don't normally just go to neonatology. You kind of have to go through the pediatric part of it because neonatology is within the Department of Pediatrics. That's kind of like the way I think about it. This whole big umbrella pediatrics, general, and then you can branch out and to do your own little subspecialty within it. And the same thing you can think about in the internal medicine or family medicine. If you ever have heard of a back specialist, right? People who specifically do surgery of the back. A lot of them either went through the neurosurgery residency, did a whole residency in neurosurgery, and then did a fellowship in back on spine. Or they could have been an orthopedic surgeons who also went through the orthopedic residency, and then they specialized in spine surgeries on top. So they do those surgeries throughout the residency, but to really, the fellowship is kind of like to focus on just that specific area to become like an expert in that region. And so in my case, I did neonatology in residency to kind of learn a little bit about the neonatology field and the babies and everything else. But to truly take care of those infants, that's kind of what I'm doing now. Like that's the training that I'm getting now to become an expert in treating infants, essentially.
And, although I've known you for some years, but when I was reading your bio, I saw those two words. Those two words stood out to me, and I'm like, okay, what's the difference between a residency and a fellowship? And I have a few people that are finishing up their grad school now, and they're like, well, I'm trying to get a postdoc or a fellowship. I'm like, what's the difference? So now I know. Okay.
Yes. So everybody, so they can be board certified in whatever specialty they do. Kind of like the residency is how you get it. And then from fellowship, I always call it like it's optional, right? Like you don't have to do it. Sometimes it's strongly recommended, but it's not a requirement per se.
Now, as you mentioned, your fellowship is in NICU.
Yes.
And how did you make that decision? Which, I know that y'all don't have kids yet, but, I know what my job is when y'all do have them.
Yes.
But how did you select that?
Well, I actually looked in residency, actually. So I had a really, really nice experience in the NICU rotation. So throughout residency, the way, at least for me or how it works, is every month within the pediatrics, you do a different subset of things. Like, for example, one month you're in the NICU, 1 month you do pediatric cardiology. So you can kind of like get a little bit of an idea of what that specialist does, right? Because even if you go into the clinic and you go to your general pediatrician, if something comes up, they should at least have an idea of what's going on so they know who to refer you to, right? And so throughout residency, you kind of get a little bit of all the fields, get a taste for all of everything. And it was during my NICU rotation in residency that I had a couple of really good experiences, with some babies who technically were very sick, and throughout the month we were able to kind of get them stable and better to the point where we eventually got them home, and parents were very grateful. They ended up giving us little thank you cards and big lollipops, a little card that says, thank you, Dr. Najar, little Batman, and huge lollipop as a thank you. And like just the feeling, that gratitude that you get from those experiences. I don't know if I couldn't find another field that I felt the same way. Being able to be in a setting where you can provide hope when sometimes it doesn't feel like there's any. That's something that really inspired me to go into that direction. And then, the other aspect of it is I've always enjoyed working with babies more than any other age group. I've always really enjoyed working with babies because I feel like they're the only ones who are truly innocent. Like it's not their fault that they got sick. It's not their fault that that things are happening to them, right? Like whatever the case is usually not up to them. Like they weren't there to cause harm themselves. And I feel like those babies need a voice sometimes, and I wanted to be able to help and provide that, be that for them as well.
That is so awesome because, you think about it and, you watch TV and, they show people in the NIC, working in the NICU, and it's not always positive. A lot of times it is. And then you wonder how people really want to get into those fields. Or you see shows where, a child was preemie and they had to have like heart surgery or something like that, and it comes out fine. And, it takes a special person, an extremely special person, to do that because babies are so tiny. And, their organs are so tiny, and you're trying to find things.
Yes.
So, hey, we've got to appreciate the fact that that you would want to do something like that. But I have a big question. On a regular day,
Right.
because I want my audience to kind of get a feel for what you do. Give me kind of a day in the life of a neonatologist doctor. A regular day in the life when you go into the hospital, the kind of things that, a normal day, if there's any such thing as a normal day.
There hardly ever is what we call a normal day in neonatology, at least in my opinion. Some people may disagree, I guess. But, I mean, a normal day for me usually starts around 6:30, going into the hospital. For the first few hours, what we do is we go and kind of like check the charts of kind of everything that happened over the course of the last 24 hours for the baby. Like, the plans that you came up with, did they work? Did they tolerate things? Feedings, are they growing? Any problems that came up overnight? That kind of stuff. Like any labs that we got, getting all those values, writing everything down, kind of interpreting why they were abnormal, if they're normal, like if you fixed them, kind of thing, things of that nature. And then coming out with plans, essentially. We eventually, around 7:30, at least for us, and this is going to be very variable depending on where people work, and every unit's a little different. But we get check out what we call like essentially the report that all the overnight events from the night team, whoever that night team was covering for that, and any new admissions, whoever they admit overnight, they also let us know about those. So we, over the day, when you're at the day, you kind of know which babies you'll be taking care of, because there's multiple teams. Like most of the NICUs are large enough to they may have multiple teams taking care of all those babies. We essentially round. In my case, I'm a fellow, so I round with a neonatologist, an attending, and we kind of go through every baby, making what the plan for the day is. As regardless of the level of acuity, how sick the baby is, we still kind of individualize the care for every single one. We go through every baby, and that usually takes most of the morning. After that, we usually have some kind of lecture. Some new topic to learn, because there's always some learning involved in the NICU. The afternoons usually are reserved for updating parents, following up on all the plans that you did, any new babies, new admissions that you may have, and troubleshooting. There's a lot of troubleshooting, like things that may have come up that you were not anticipating and things of that nature. That takes a lot of the afternoon, and then checkout is around, depending on what unit you're at, 4 or 5 p.m. You check out whatever plans you have, all the babies to the night team, so they can kind of take over, and then if you're lucky enough, you get to go home at 5 p.m. And otherwise, whenever we do call, because at least in where I work, we do what we call call. We actually end up staying there all day and all night. We do 24, 28-hour shifts. And so, you're there, you get there 6:30 in the morning on a Monday, and you get to leave at 10 in the morning on Tuesday. You're just kind of taking care of babies all day. And dealing with, like I said, a lot of it is just troubleshooting, dealing with whatever comes up, whether it's, new deliveries, new moms who came up, laboring and they're premature, or known cases that were scheduled already, and we're just anticipating those, or you never know. Transfers, we do a lot of transfers, as you know. You've probably been to Temple because Colleen is there in Fort Hood.
Yep.
So we actually get a lot of transfers from there.
Wow.
Our Nicu is the highest level Nicu in the Central Texas area, and so any kid who has any potential problems that cannot be taken care of in a specific unit usually gets into us.
Wow.
So that's why we do a lot of. Every day is. I don't know if there's ever 2 days that are the same.
I can imagine. Imagine. Now, how long will this fellowship be?
3 years.
3 years? And you're into which year of your fellowship?
I'm in my second year. I'm a second year of 3.
Okay. And how long was your residency?
3 years. So most primary care residencies, and what I mean by primary care are usually pediatrics, internal medicine, family medicine, are 3 years.
Mm-hmm.
And then if you want to follow with a fellowship of any sort in pediatrics, almost all of them are 3 years.
Mm-hmm.
And adults, it varies depending on the specialty, between 1 and 3 years as well.
Oh.
Same thing with family medicine. So that's, in my case, I'm in second year of my fellowship, or if you want to think about it, I'm on my 5th year of training, I guess, going from residency into fellowship. Yeah.
Wow.
It's quite a long process.
So have you thought about what you're going to do or where you may go after this?
I don't know. I have thought about it, but I don't know. A lot of it is based on wherever there's a job openings, really.
Yeah.
Wherever there happens to be some kind of neonatologist opening and seems like a good position in a good area, I would strongly consider it. And so at that point, I don't know if it's still too early to be able to know exactly where I would want to, where I'm going or whatever, because especially with COVID, COVID also affected hospitals and hiring and the medical field as well. Everybody got affected. It wasn't just, it wasn't just not doctors or whatever. So that's also been another factor that will play in the next few months, into the next years, to see what happens. And so from there, I'm kind of I'm staying open-minded and seeing what happens next. Because if there's something I've learned, is you can't force your way into something, because usually God has a different plan for you, and you can't fight that. I learned not to be stubborn and just go with the flow.
Hey, you've never been stubborn in all the years I've known you and Alicia. Y'all are like the most motivating couple I've been around. So that's why you're doing so well, and I listened to you, Fernando, or Dr. Najar, and you're doing what you love. You're not just doing this because you have to. You're doing this because it's something you're really passionate about. And to be able to do something that you're passionate about it will never feel like a job to you. It will always feel like your life. Now, for those of y'all who are just coming on and listening to us, I am here with Dr. Fernando Najar. He is a doctor of osteopathic medicine, pediatrician, and he is currently in a fellowship at Baylor Scott and White in Temple, Texas. Now, we've talked about your medical background and all of that great stuff, and I can talk to you for hours because we've known each other for a little while.
Yes.
But I know that you are a very, very strong supporter of STEM education. Can you tell me why? I mean, it is so important, especially, amongst young people such as yourself.
Well, I've always been a big fan of STEM because I believe that that's kind of where our future is heading. The fields of technology, engineering, math, you need that background to be able to be competitive and be somebody in the new world, right? Like it seems like every day, like new things are coming up, new technologies, new processes, new software, everything. It seems like you can't keep up sometimes, right? But having that background, I think, in any of these fields would be very beneficial in the long term to be able to move on to whatever comes next, really. Because the current students, wherever, elementary kids, middle school, high schoolers, they're going to come up with new things that haven't been invented yet. Just 10 years ago, or when I was in high school, the iPhone wasn't around, right? Like that came out as I was graduating, and now like everybody just knows what an iPhone is, right? Like there's so many things that have come up just in the last, if you think about the last 10, 15 years, that we don't know where the next 10, 15 years will go. And it seems to me that the people who are in the STEM careers usually are the ones that are the pioneers, that are in the forefront of innovation. And it seems like that's where our world is heading, and that's why I've always been a very big support and proponent of people getting into the STEM field, whether it's men or women. Like I think a lot of girls are still very underrepresented in some of the fields, and they bring so much. They bring so much to society, and they're very, very smart, very bright women out there. That I think that should be encouraged to continue pursuing that, because that's the way we're also going to be able to advance as a society as well.
Yeah, I mean, let's think about this. I mean, women of color, men of color, getting into these fields is always going to be important, because how you look at the world is different. Okay. Right. How you look at the needs of the world is different. When you look at a mother who is a NICU doctor or a NICU nurse, she's had kids, and she may have a different outlook on how a man may look at it. Not that men don't know, but, I have children myself, and my older son, and you speak of the asthma attack. He got really, really sick one day, blue lips, took him to the emergency room, and they're like, "You're just over exaggerating. Go home." Took him home. Luckily, a friend of mine was a nurse, and she was a pediatric nurse, and she came over, and she said, "Okay, turn on the hot water." And he was having an asthma attack. And the next morning, that night, we took him back, and she told the doctor, this is what's going on with this child. And, he looked at her, and he's like, okay, she's a nurse. She knows what's going on. And, Taylor was able to be taken care of. But, things are constantly evolving. Things are constantly changing. And you're talking about the STEM fields, and it's not necessarily somebody has to be a doctor or an engineer or something like that. I mean, look at the things that are coming out based on our current situation. Right. Equipment, what was that? The respirators. People are coming up with respirators that can have more than one person on the same respirator and not cross-contaminating each other. Right. So, I like the fact that you say ideas, things are evolving so much, and they're going to continue to evolve in every aspect in so many fields. So, right.
And I've always been a STEM person. I actually come from a STEM background, if you will. My dad actually has a dual degree, I guess, in chemistry and civil engineering. One of my uncles is also a chemist and a chemical engineer. And like my cousin is also a chemist. Like I come from a chemistry background, so it almost seemed fitting that I would go into the field as well. But one of the misconceptions that I seen a lot of young kids have is that people who want to go into medicine need to do chemistry or do biology, and that's not the case. All you need is just the prerequisites that medical school requires, but you can study wherever you want. Like if you can, I encourage some kids, if you want to do engineering, go ahead and do engineering, right? If they want to be math, or if they want to get into, something, computer science, they can study anything they want in college before going to the medical field. But I've always felt like whatever background you get, you always bring that knowledge that you gain with you. The example you gave of the ventilators, people coming out with the ideas of connecting to with that cross contamination, a lot of those people had a background in engineering, or like they worked in fields that are not always medicine. It always, I feel like sometimes does help to have an outside perspective, to bring a new twist to something that's even old. I had actually been reading this book called Range, and it talks about, not always subspecializing, not always going to the very specific thing, and having a background in a little bit of everything. Usually people tend to do better as a whole, in the job, in life, in everything. Like it always helps to bring, it's like, oh, I used to do this, I used to work in this, and now I'm in this field. Especially you, Dr. Payton, who was in the Army, and now you're a teacher. Like I'm pretty sure you implemented some of the ideas you brought from the military into the school, and they seem to be applying very well, right? Like it's something that experiences that you may otherwise have never gained, but because you did, have actually helped in your current situation, your current position, right? And that's something that as I've gotten older, not that I'm very old, but I've learned to appreciate, right? And that's why I always believe in a very diverse background, and people not honing in on just the one thing. In my case, I happen to, I guess, get lucky enough to know that medicine was my calling, but not everybody gets that. That intuition that early, and so I've always been like, hey, just try everything, and then you eventually figure out what it is that you like, and that's usually one of the philosophies I have, and in particularly for me for STEM, like I was always stern, like, oh, I'm going chemistry and never biology or physics and whatever, and I realized I'm like, they're all interconnected. Like it doesn't, I don't know why it's so stern about one and not the other, or engineering, any of that. I don't know. That's usually my philosophy, I guess.
Well, the thing is, I'm listening to your entire story. You started with the big picture of you wanted to be a doctor, and then as you grew in the field, and as your wife said earlier today, everything is a grind. Every time you take a step, you learn something new. Yes. And you went from medical school to your first residency. In your first residency, you found that you liked pediatrics. And then from pediatrics, you found that you liked neonatology.
Yes.
And, you've honed in your skill set. And some people may be happy just being a pediatrician, a general pediatrician,
right?
Or, someone may want to go all the way down and go into podiatry, you know. So.
And that's very true. I mean, even now that I am doing neonatology, which is a relatively specific field, I still use a lot of the concepts and a lot of the knowledge that I gained in the residency. It's like even things that don't relate to babies or to the Nicu. Things that I saw pulmonologists do, or cardiologists, or gastroenterologists, be like, hey, they used to do this over there in Houston. Have you all thought about doing that here, right? And it's something that's like, oh, I never thought about that before. Bringing those new perspectives sometimes does help, even if you're within your own field, right? Like, I'm kind of blanking on any, like, I always think of engineering, right? And you think of chemical engineering, and it's like civil engineering and mechanical and electrical. And I remember when I was an undergrad, people being very stern about like, no, I'm a mechanical engineer, not electrical, or vice versa, and they would like get offended, right, if you like call them the wrong one. And then you ask them what classes they're taking, it's pretty much the same ones. They just kind of like they're looking at it from a different perspective, and you're like, really?
Yep.
Like, you could probably connect the two and do so much better sometimes.
And you're so right. And speaking of the whole being an advocate and a supporter of STEM, there was one thing that I loved about UNT, and I'm quite sure they do the same thing at Baylor, Scott and White, is they would have tours to let young people come through and look at what they do and what they are doing, and talk to young medical students and ask them about themselves and how they got there. Those kind of things. How important are those to our next generation?
Very. They're very important. Actually, thanks for reminding me. I actually used to do that.
Yep.
I forgot you. As you were talking, I was like, so as a UNT medical students, they were bringing high schoolers over the summer, and we were actually taking them to the anatomy lab and teach them a little bit of anatomy there. And we would get a little piece of orange or a little bit of pigskin and then teach them how to suture, right? Like those little things to get them interested in, not just the little coloring and then at school about anatomy, like this is the arm, right? Or this is a humerus, and it's so boring. Like put the concept with the real thing and be like, hey, look, it can actually be exciting. I think it's very important. At Scott and White, the hospital itself is actually affiliated with Texas A&M, the College of Medicine.
Uh-huh.
So I think A&M does that a little more, but their campus is actually based out of College Station, Bryan College Station. So I think a lot of more of the young kids actually end up going there. But we do have, or before COVID, we had volunteering positions where people would come in and even be greeters or, whatever it is that we could have them do that would be suitable for what they were interested in. I know they would do it, and we used to do the same thing in Houston. So a lot of the places do recognize the importance of the upcoming generation, getting that first foot, getting that first taste of what things could be, right? Getting that inspiration to have them remember those experiences when things get hard. Be like, hey, no, you know what? It seems worth it.
and you're so right. It seems worth it. It's going to be worth it, and it's the things that you remember. And it's something that you mentioned early in the show when you were talking about going to high school. I've had friends, I've had relatives that said that they wanted to be a nurse or they wanted to be something else. And when they got a taste of it, they changed their mind. Mm-hmm. Or when they, especially some of my friends who wanted to be nurses, when they went and found out what nurses really did, some of them like, oh yeah, I love this, I'm going to continue. A few looked at the fact that, oh, wait a minute, I've got to deal with blood. And they found out that they were a little squeamish. And then they took another route, another aspect. And many of them still stayed in the hospital type fields, but they just took a different aspect. And, I think that's why these journeys for people or these experiences are extremely, extremely important.
Yes, they are. And it's never too late to do anything. That's the other thing. I guess I would also say is like it's never too late to change fields. It's never too late to follow what you feel is right. I know for sure at least several of my classmates were in their second or third careers. Late 20s, early 30s, even mid 30s as medical students. I had accountants and engineers, and we had a few military guys who had served in Iraq and Afghanistan, were in the Marines, and now we're coming back after so many years of being on service to to do their medical training. And, they already had a family and everything else. And now they're all full-fledged physicians, whether they're within the Army or in the civilian world. For example, in the Army, or now, full-fledged doctors, despite the fact that they had done something else beforehand. And I'm sure that a lot of them would actually have a little bit of an even advantage on me, because that previous experience is helping them now, right? Like what actually my co-fellow, the other girl who's there with me, I mean, she had a whole life before medical school. She was in the, I think, business industry. Like I can't remember what it was, but she used to do something else completely. And so now she's the one that teaches us how to do all the, how to save and how to not save, but like, how to invest in retirement and all that kind of stuff, because she had that experience in the past. So I would say is like it's never too late to really follow your calling, whatever that is.
And that is so important. It's the lessons that you gain from other people too, not just the lessons that you learn from doing your specific career field.
Yeah.
That has got to be important as you go through this journey of life. And I never thought of the number of engineers or people from business or people from other fields, and the number of people in various age groups that make such a transition as becoming a doctor or a dentist or whatever, going into the medical field. And I know when I was at Northside with Alicia, and I was in her classroom. Y'all had left, and she doesn't know this, and she'll kill me when she hears this. I was in the classroom, and I'm teaching, and they've never seen me sit down and teach. Never done that. And I'm sitting and I'm teaching. The other teacher comes in, and he goes, "What's wrong?" And I said, "Oh, my chest is hurt, and I'm fine." And they thought I was having a heart attack in the classroom, in her old room. And come to find out, my blood pressure was like 198 over 140.
Wow.
And don't yell at me. Don't yell. I'm taking better care of myself. Leave me alone.
I'm not. I'm just more like the numbers. Okay, it's high. Okay.
Yeah. And so when I was at the hospital, which, they embarrassed me by threatening an ambulance and all the embarrassing stuff, the nurse that took care of me, he was a science teacher for years. And he decided one year, he goes, "I think I want to be a nurse." And he went to nursing school. And I was like, "How many years did you teach?" He taught like 15 years. And then he went to nursing school. And he's like, "I'll never regret this. I will never regret making the change." He goes, so,
But I'm pretty sure that even some of the experiences he learned as a teacher, he's applying it as a nurse, right? Like,
oh yeah.
I mean, one of the things I even with Alyssa I've noticed is like you learn how to talk to people, right? Like you learn how to be patient. Sometimes in the schools, teaching high school and things of that nature, you got to be patient, right? Like with the teenagers, and they don't always listen, but you have to keep your calm sometimes. And when you have a patient who's not very cooperative or whatever the case is, that experience comes right back in. Like it's stuff that doesn't go away.
And he was so calming to me, because he started talking about the kids and what he did in the classroom, and I was like, it just, I think it's what kept me from freaking out while I was there. But hey, we have another minute left, and I know this conversation has gone so quickly.
Yes.
But Dr. Najar, I want to thank you so much for agreeing to do this.
Thank you guys for inviting me.
I have learned so much from you, and I wish you every bit of luck in your endeavors. I'm not going to call this career. I'm going to call this your passion. You know your why in life. And I know your families are so proud of y'all. And, if you could give us one sentence that you want to say to people who are considering STEM fields, would you give that to us before we have to go?
Sure. Go out at full steam. that's pretty much what I would say. Like, when you commit to something, just make sure always do it 100%.
Okay.
You're always going to learn something new.
All right. Well, Fernando, Dr. Najar, I want to thank you for coming on. And ladies and gentlemen who are my wonderful listeners of All About STEM Radio Show, I will be back next week from 7 to 8 p.m. Central Time on Fishbone Radio Network out of Globe Light Park in Arlington. And if you miss this fabulous show, you can listen to the podcast at fbrn.us. Or you can listen to it when I post it on my YouTube channel. But I want to thank you for coming on, and I want to thank my listeners for listening. And next week, y'all going to have a surprise. I'm not even going to tell you who's coming on this time. You're going to be surprised because this is a power couple. I think I just let it out of the bag.
Thank you, Dr. Payton.
All right. So.